My name is Ajay Arora, and today I'll be presenting the disease of norovirus. Norovirus is often described as the perfect human pathogen. It's highly contagious, it rapidly and prolifically spreads, and it's constantly evolving, causing limited immunity. Not only that, it is the leading cause of diarrheal disease and foodborne disease in the whole world. In the U.S., it causes about 21 million cases of gastroenteritis every year. In developing countries, it causes 200,000 deaths each year in children under the age of 5. Today, I'll be covering the following, starting from history until my current research from the norovirus vaccine. So norovirus was first described by Dr. John Zahorsky in 1929. He recorded sporadic cases of vomiting and diarrhea from November to May. And the reason why he had so many cases was because he lacked sanitation and patient care. So the first outbreak of norovirus occurred in Norwalk, Ohio in 1968. It was an outbreak of gastroenteritis among the children and teachers of an elementary school. The virus identified was named after the town it came from, Norwalk virus. So norovirus is also called viral gastroenteritis or food poisoning. It's basically inflammation of the stomach and the small and large intestines. It is also sometimes referred to as the stomach flu, but it actually has nothing to do with the actual influenza. So noroviruses are non-enveloped, single-stranded RNA viruses. They're classified in the family Calyciviridae and the genus Norovirus. They have a non-defined surface structure as shown here. And they're highly and dangerously infectious because they're stable in various conditions and they spread easily. So noroviruses are separated into 5 genogroups from G1 to G5. In G3 and G5, they cause norovirus in pigs, cattle, and mice. Now there are 26 viruses that cause norovirus in humans. There are 8 in G1, 17 in G2, and only 1 in G4. And because there are so many strains, it is very difficult to develop immunity for norovirus. So these norovirus particles are very special. They are able to survive high levels of chlorine and temperatures up to 600 degrees Celsius. And once an infected person sheds over 1 million virus particles in their stool. Not only that, but it takes less than 100 virus particles for someone to become infected with norovirus. So there are many risk factors of getting norovirus. If you have an impaired immune system, you're more likely to contract norovirus. Other risk factors include living where food is handled with unsanitary procedures, or you live with a child who attends preschool, or you live in close quarters, or you stay in hotels, resorts, or cruise ships. Now I will talk about the causes of norovirus and how norovirus is transmitted. The most common way that norovirus is transmitted is person-to-person transmission, or having close contact with an infected person. Other ways that norovirus is transmitted is including consuming contaminated food and water, touching your hand to your mouth after contact with a contaminated surface, and airborne transmission. And so the way that this happens is when virus particles are spread through vomiting and diarrhea, they spread in the air. The most common symptoms of norovirus are diarrhea, vomiting, nausea, abdominal cramps, and dehydration. Others include fever, headache, and muscle aches. And so the diagnosis of norovirus is usually based on its symptoms. It can be identified using laboratory tests, and so what doctors do is they retrieve stool or vomit samples from patients. So there are many laboratory diagnostic methods that can be used. And the most common method is called reverse transcriptase, real-time polymerase chain reaction, or RT-qPCR. And what this does is it detects the amount of viral DNA in a sample. And another common method are enzyme immunoassays. And what they do is they use antibodies to detect antigens presented by norovirus. However, this method lacks specificity and sensitivity, so most scientists use PCR. Currently, there's no vaccine for norovirus. The CDC recommends people to drink plenty of fluids to counter dehydration. And for severe cases of dehydration, they recommend IV fluids to be given through the veins. Another source of treatment is for one person to be given anti-motility agents to treat diarrhea. There are many steps that must be taken in order for someone to prevent norovirus from being in their system. You can practice proper hand hygiene, wash fruits and vegetables, and cook seafood thoroughly. Stop working from the moment you begin feeling sick until 48 hours after recovery. Avoid traveling until all symptoms disappear. And make sure, once somebody vomits, make sure to disinfect that contaminated area with a chlorine bleach solution and wash laundry thoroughly. Now I'll be showing you a couple of graphs and charts to show the demographics of norovirus outbreaks. So what this chart here shows, it shows that the most common place for outbreaks are in healthcare facilities at 62.7%, and most of the other outbreaks occur in restaurants at 22.1%. And other outbreaks have been shown to be found in schools or private residences. And so this next graph shows when does norovirus occur, and it shows that most outbreaks occur in January or February. But this graph also shows that a majority of norovirus outbreaks are non-foodborne. And this final graph shows what causes gastroenteritis outbreaks. It shows that norovirus is the main cause of gastroenteritis outbreaks. And so, hospitalization visits. Toddlers average around 9.4 hospitalizations per 10,000 people. Meanwhile, senior citizens average 8.1 hospitalizations per 10,000 people. Not only that, but every year, norovirus causes 399,000 emergency visits and 1 million outpatient visits per year. And this leads to $284 million in healthcare charges. Norovirus causes around 797 deaths per year in the United States. 90% of those are among the elderly. Norovirus causes 71,000 hospitalizations per year, which leads to $493 million in healthcare charges. And so, here's some current research for the norovirus vaccine. An experiment that I examined was entitled A Dual Vaccine Candidate Against Norovirus and Hepatitis E Virus. And so the objectives of this experiment were to develop and test a dual vaccine against both norovirus and hepatitis E, and to see how the immune system reacted. The hypothesis was that this new vaccine, it will cause antibodies to be in the mice's blood that are being tested and give the mice immunity against norovirus. And so the results showed that the hypothesis was correct. The dimeric proteins norovirus, hepatitis E virus, and GST increase the antigen binding of the norovirus P domain. The complex of norovirus and hepatitis E virus increase the production of norovirus antibodies the most. And this mouse antiserum, extracted after the experiment was complete, it neutralized norovirus, showing that the vaccine worked. And this is very important because this could lead to a vaccine in the future. And so in conclusion, norovirus causes viral gastroenteritis. It's highly contagious, and the most common symptoms are diarrhea and vomiting. Norovirus can be diagnosed by laboratory tests, and there's no current vaccine present, but research is being done to hopefully find one. Did you know that a norovirus outbreak occurred here in Dallas, Texas, only 1 year ago? 675 students out of 2,500 at Richardson High School fell sick because of norovirus. There was no vaccine to prevent students from being infected. So the lesson learned was to make sure to sanitize and keep good hygiene. The real question is, where will norovirus go next? Here are my citations, acknowledgements. Thank you. Any questions, comments, or constructive criticism? Quincy.
I would like to start by saying you did a fantastic job. And I'd like to ask you who it affects, like norovirus, like mostly.
Can you repeat that question?
Who does norovirus affect mostly? Like who?
Norovirus usually affects toddlers under the age of 5 and most senior citizens. Does that answer your question?
Yes.
Chris.
AJ, you talked about how the places where norovirus is mostly common. Why is it common in like hotels and cruise ships?
You know, norovirus is easily transmitted because if you touch a surface that has norovirus on it, you get norovirus. There's no chance that you don't. And so, people in hotels and cruises, they live really close to each other. So it's really easy to become in contact with an infected person and get the disease. Mongoose.
Your disease, I think you went over it already, but I don't really remember it. Is it fatal if you contract it? Or
No.
only if you don't
No.
get treated?
No, it's easily, in most people, where there's sufficient treatment, it easily goes away. Maya.
How would you know if the food or water that we're about to drink is contaminated?
You actually don't know, so the best thing to do is to wash your hands and just hope for the best.